the elder. Do not block her view of herself in the mirror. Using all the general techniques, let her know you are going to brush her teeth. Then see if she will accept the toothbrush. For residents who have dentures, you will need to have the following materials assembled: gloves, a cup for the mouthwash, a denture cup, towels, a denture brush, a soft toothbrush, and a denture cleaning product. Ask the elder to remove the dentures him or herself. The lower denture is easier to remove, so ask the elder to remove the lower denture first. If the older adult has difficulty removing the upper denture, ask the elder to puff his or her cheeks to break the seal. You may need to pantomime. Sometimes cheek puffing does not work. In that case, carefully place your forefingers along the edge of the upper denture and your thumbs on the biting area. Rock the denture gently back and forth, breaking the suction. Gently remove the upper denture. If the elder is completely unable to remove the dentures, you will have to do it yourself. First, remove the lower dentures. Use your thumb and forefingers to gently peel the lower lip back to expose the margin of the lower denture. Next, use your thumbs to push on the lower border and your forefingers to grasp along the edge of the biting surface to pull the lower denture out. To remove the upper dentures, carefully place your forefingers along the edge of the upper denture and your thumbs on the biting area. Rock the denture gently back and forth, breaking the suction. Then, gently remove the upper denture. After you remove the dentures, examine them for broken or missing teeth and rough edges. The dentures may need to be repaired or replaced. If the dentures are loose-fitting, they may need to be replaced with smaller ones as well. It is not sufficient to place dentures in a denture cup with denture cleaning tablets. Scrub the dentures with the denture brush. All debris needs to be removed. Do not use toothpaste with dentures. Some toothpastes contain particles that can damage the artificial enamel surface. Instead, use denture cleaner. Rinse the dentures well before replacing them back into the mouth. After the dentures are clean and before putting them back in the mouth, either you or the elder should brush the older adult's tongue using a soft toothbrush. If the elder has teeth, complete mouth care as you normally would for a dentate person. Finally, the mouth needs daily assessment for any abrasions or lesions that can be hidden by the dentures. The final step with all mouth care is to apply moisturizer to dry, chapped lips. Unless the older adult is retiring for the night, you can replace the dentures. Most elders will insert their own dentures. Allow the elder to replace the dentures in whatever order they choose. If you have to replace the dentures, insert the upper one first and the lower one second. Older adults with dementia can also resist you when you are trying to remove their dentures. The same techniques we discussed earlier can be applied in this situation. For hand over hand, you can either place the elder's hands over your own hands, or place your hands over the elder's hands and gently guide the elder as the dentures are removed. If the care-resistant behavior does not diminish with the hand-over-hand technique, you may want to use bridging. In this case, allow the elder to hold onto an old pair of dentures while you remove the dentures. Another technique is to have the elder hold the denture cup while you remove the dentures. If the older adult tries to remove your hands, you can use a combination of hand over hand and chaining. Gently place his or her fingers on the dentures and see if the elder will imitate the motion and remove the dentures. If the elder absolutely refuses to perform or receive mouth care, try to determine the cause. Was it your approach? Your approach may have inadvertently caused agitation or frustration. Did you give the same command multiple times? Did you try to hurry the elder along? Was the elder trying to communicate other needs? For example, is he thirsty and wants a drink first? Or does she need to go to the bathroom? Is there mouth pain? If you suspect mouth pain, assess for bad breath, which can be caused by bleeding or infections. Also, look for loose or broken teeth. All of these conditions warrant a dental referral. This concludes the video on providing mouth care for people with dementia. Thank you for your participation.